Hi everyone, it's me, Dr. Whimsy, and today we're talking about a subject that I deal with a lot in my private practice, and that is small intestinal bowel overgrowth. This is a condition that we are at greater risk of developing the older we become, and this is why in the population that I treat, which is predominantly people over the age of 40, I see a lot of small intestinal bowel overgrowth. SIBO. I want to talk a little bit about not only what this condition is, but who is at risk, how it gets diagnosed, and how we treat it. And so bear with me because it's a really big subject, and I'm going to try and tackle everything to the best of my ability. This video is going to be a little bit longer than some of the other videos I have done because it's really a complicated conversation. In a healthy person who doesn't have any digestive problems, they don't even think about it, they eat their food, they digest it just fine, and they have no pain or symptoms, we're not going to see SIBO, we're going to see a beautiful digestive tract, and we're going to see not much bacteria in the small intestine. Predominantly, we're going to see bacteria in the large intestine where it breaks down cellulose and it helps feed healthy gut flora and does great things for our immune system. That's really what we want to see in a healthy digestive system. However, in a person who struggles with small intestinal bowel overgrowth, the bacteria that normally should be sitting in the large intestine doing its job of maintaining healthy gut bacteria, improving immune system, etc., that bacteria has moved its way up into the small intestine, and it's now creating all kinds of problems. When you have the symptoms of small intestinal bowel overgrowth, you can get gas, bloating, upset stomach. We often will diagnose this person initially with irritable bowel syndrome, not knowing the cause of the pain. Your doctor might check for something like H. pylori to find out if you have a stomach ulcer, but they might never test for SIBO, and so the person simply walks out of the doctor's office in pain and never gets properly diagnosed. And that's a shame because a large percentage of the people that have irritable bowel syndrome, it's often because they have just too much bacteria in the small intestine causing that pain. So in addition to gas and bloating, upset stomach, which you might see with a patient that has bacterial overgrowth in the small intestine, you might also see other problems as well. For example, you might see joint pain, acne. Bad breath is not uncommon because the bacteria is higher up and it's producing things like methane, hydrogen, and that methane is coming out through the mouth and it's creating bad breath. So basically, this is a patient who's not going to be having normal digestion, or what we call normal peristalsis. Peristalsis is that wave-like motion that we want to see in a healthy digestive tract, that it allows food to move through the digestive tract, starting with the small intestine, reaching its way to the large intestine, and then eventually the colon, where it's stored until it can be eliminated. So we have a loss of that, a disruption in that peristalsis. In this population, you might see poor pancreatic function, which is why in older patients, you might be at greater risk. Why? Because as we get older, our pancreas might not function as well as it did when we were younger. The pancreas may be producing less enzymes. Enzymes are products produced by our pancreas, which is an organ that sits right here, and enzymes help tear apart and break down that food into smaller particles so that it can be absorbed. Food absorption, nutritional absorption, takes place in the small intestine, and that's disrupted when we have all this bacteria there. If we have low pancreatic function that doesn't tear apart and digest the food into smaller particles, then those non-digested food particles will will make their way down the digestive tract, where bacteria will begin to feed on those undigested particles, creating the symptoms of SIBO. This is something we see quite a bit in older patients. Older patients will often give off what we call the scent of SIBO as the digestive tract declines in its ability to properly digest food. So another factor that we have to take into consideration in our older populations is not only a loss of that pancreatic function to break down the food properly, but also a decline in dental care. If your dental care is not up to par and you're losing teeth, or you are not able to properly chew, you don't have a good bite, that's another risk factor for SIBO, because you're not chewing your food into smaller pieces. Basically, you want to make sure that you begin the process of digestion pretty early on, both by having good pancreatic function, but also that first part where you're chewing the food into smaller pieces, mixing it with saliva, which contains enzymes from the pancreas, to begin breaking it down so that absorption can happen higher up in the digestive tract and not be food for bacteria. Hopefully I said that in a way that makes sense to the audience. So good dental care, good pancreatic function. Things that can affect pancreatic function can also be stress and certain pharmaceuticals, and we'll get into that a little bit later. One of the things I have talked about in the past, and I'll talk about it here again, is the early phase of digestion, which we call the cephalic phase of digestion. That is when we are just starting the process of eating something. We call it the cephalic phase, the beginning, the head of digestion. And this is the part of digestion that is often disrupted in people who suffer from SIBO. The cephalic phase can sometimes begin with a thought. Just thinking about food can cause us to produce more saliva, can encourage the pancreas to begin producing enzymes. If we're stressed, if our thoughts are somewhere else, that can inhibit the cephalic phase of digestion. If we're a stressed out person, if we're a depressed person, that can affect this early phase of digestion. The blunting of the cephalic phase of digestion, repeated blunting of the cephalic phase of digestion, is one of the factors I often see in people who have SIBO, particularly in young people. Highly emotional, creative people, artistic people can often have SIBO because they are often very emotional, stressed out, and so they're not thinking about food. They're not focused on the process of getting ready to eat that food. We see a blunting in the cephalic phase of digestion. The cephalic phase of digestion can often be encouraged by smelling food. You smell the food, that tells your brain food is coming, and saliva production increases, pancreatic enzyme production increases, again preparing the way for digestion. Hydrochloric acid produced along with pepsinogen, which breaks down into pepsin, is also part of the early phase of digestion, usually around the second phase known as the gastric phase of digestion. So once you smell the food and then begin eating the food, from the cephalic phase we move on to the gastric phase. The food goes into the stomach where it is churned by the stomach, mixed with more pancreatic enzymes and hydrochloric acid and pepsin, and broken down even further. So it's really, again, those first phases of the digestion that are blunted in a person who's at risk for small intestinal bowel overgrowth if they are over the age of 40. Some of the symptoms of small intestinal bowel overgrowth are gas, bloating, upset stomach, cramping in the digestive tract. And I want to be very specific here what I often see in my office. I see cramping in a lot of the time, or pain or heat in something called the ileocecal valve. And how you find that ileocecal valve on yourself is that you find the upper part here of the hip, right around there. You find your umbilicus, your umbilical, where your belly button is, and about 2/3 of the way down between those two spots. Well, actually, you're going to come around the hip. You're going to go over the crevice of the hip, and you're going to hit that point there. Well, it's like that. This is how doctors do it. We locate the spot, and then 2/3 of the way between those 2 points, we press. If we get pain, that can be inflammation and irritation at the ileocecal valve. The ileocecal valve separates the small intestine from the large intestine. The distal portion of that area, the later part of that small intestine going towards the large intestine, it's closed by a valve, and that valve is there to make sure that no bacteria come up and begin to spread to the small intestine where absorption takes place. And just for curiosity, it's in that distal portion of the small intestine where B12 gets absorbed. So if you have inflammation in that area, it's not unusual to see maldigestion of vitamins like B12 in this population, macrocytic anemia, if it's not treated quickly enough. You also see, because there's inflammation, a production of what we call inflammatory markers, and those inflammatory markers can lead to muscle pain, etc., etc. So we've got a disruption of the natural process of digestion, maybe due to poor dental care. Maybe it's due to a pharmaceutical that's been taken. For example, if you're taking proton pump inhibitors and your hydrochloric acid levels have been dampened, that can certainly affect the gastric phase of digestion. Chronic use of steroids treatments, which can inhibit the natural flora, inhibit the body's ability to produce certain bacteria as well that protect against invasive pathogens, can also disrupt natural flora. Antibiotics are a big problem because they kill off all the flora. The broad spectrum antibiotics will kill off the good bacteria in the digestive tract, and that can lead the way to opportunistic infections, parasites, but also we can see yeast overgrowth or thrush on the tongue. That's not unusual. So how do we test to rule out a case of SIBO? Usually doctors will do what's called a breath test. That's the gold standard. And what we do is we feed the person a sugar. Lactulose is the sugar. And we're checking to find out, number one, if you've got too much bacteria in the small intestine. But we also want to know what type. There's two types. There's methane producing, and there's the type that's producing hydrogen. It's been my experience that in the early phases of small intestinal bowel overgrowth, we'll see a hydrogen positive breath test. But as the condition progresses, we might see a methane producing or both. Because the methane producing bacteria called Archaea they feed on hydrogen, you might actually have both types of bacteria but only test positive for the methane gas producing Archaea. So what do I do that's a little different than other doctors? For starters, again, if it's a population that it's over the age of 40, poor pancreatic function, or simply stressed out, you have to be able to address why this happened. That is naturopathic medicine. We need to know how we got to where we're at. How do we fix it? How do we get to where we're at? Is it poor dental care? Is it a poor bite? Is the person eating too quickly? Are they chewing their food properly? What are they eating? Are they taking a pharmaceutical that could have somehow dampened normal digestion? Why isn't peristalsis happening properly? Again, if you're stressed out, if you're someone who's suffering from depression, if you have a lot of anxiety, that can blunt the process of digestion. This is why people will often be treated for depression by going on a selective serotonin reuptake inhibitor like Paxil, and then digestion will improve because they're no longer stressed out, they're no longer in a state of fear, they can relax, they can digest their food. So we always want to find out how this happened. If it's a case of not producing enough pancreatic enzymes because a person is older, we can support that by giving proper digestive support in the case of enzymes. All right, so there's a lot of things that we can do to help the patient. So we remove the cause that led to the condition in the first place. Removing the pharmaceutical whenever possible, or changing up the dosage, taking care of any dental problems the patient may have, encourage the patient to slow down and chew their food, smell the food, think about the food before eating the food, chew the food really well, consuming less food. That's a hard one for people, but we find that when a person who suffers from SIBO leaves the table 80% full, SIBO symptoms can improve. And that's because if you are someone that has limited pancreatic enzyme production, if enzyme production has declined because you are older, be aware of that, because less food means less need for enzymes to digest the food. So if you have more food in your digestive tract than enzymes are able to digest it and break it down, simply dropping the caloric intake, chewing it really well, can help with SIBO symptoms. So I want to really point that out to people. If you've cut your caloric intake, if you're chewing your food really well, if you're encouraging that cephalic phase and smelling the food, chewing the food, etc., that in and of itself is going to have a dramatic improvement on your health and SIBO symptoms. Want to reduce the caloric intake. I have had success with people who do intermittent fasting. Those are people that will stop eating after, say, 6 o'clock and then not begin eating again until the following day. And the reason why that works so well is because the less you eat, not only are you producing more adequate enzymes for the food you are consuming, but the bacteria count drops. And the bacterial count drops because there's no food for the bacteria to consume. So say you complete your last meal at 5 or 6 o'clock, and then I give you herbal medicine or some kind of a natural medicine to get rid of the SIBO. I would usually have the patient take those dosages at night before bed. Why? Because the digestive tract is empty, the bacterial count has dropped. Before going to bed, we give you a large dose of products like berberine, golden seal, echinacea, wild garlic can be helpful, oregano oil can be helpful. The person goes to bed on an empty stomach. Those herbs, those medicines then work their way through the digestive tract. They sweep through the digestive tract, killing off that SIBO. In the morning they can have a meal. Again, they're eating responsibly, not large meals, chewing their food well, and taking a good digestive enzyme. Those are the things that can have a dramatic impact on SIBO. So intermittent fasting and timing the medication for at the right time really is important if you want to effectively eradicate SIBO. I always give glutamine to my patients. If a patient is having an aggravation with the glutamine, I tell them to take the glutamine in smaller doses throughout the day, because it can be excitatory in some patients, and to mix it with food. And that will release the glutamine more slowly into the system, allowing it to be better tolerated. So that is my treatment. It usually takes about 21 days to 3 months. We're rebuilding the gut in the daytime and we're killing off the microbes at night. We are doing intermittent fasting and we are reducing caloric intake so that the patient has adequate enzymes to digest the food. I also put the person on a carbohydrate-specific diet, like a FODMAP diet, so that I'm reducing complex carbohydrates that might be difficult to digest, particularly in older patients with poor pancreatic function. In addition to all of that, you may want to look into core strengthening exercises and abdominal exercises that are part of yoga that strengthen the digestive tract. And by doing those strong core exercises, you are actually helping encourage healthy peristalsis. So I really think that yoga and Pilates or any kind of an exercise program that strengthens the core is something vital to healing SIBO. A strong core, rolling the stomach exercises, which are part of traditional yoga, have a dramatic help dramatically improve SIBO. And last, meditation, prayer, relaxation techniques. If necessary, speak to your doctor about a low dose SSRI if anxiety and depression are a factor. That can also help. So as you can see from this brief video, treating SIBO is a complicated condition. It should never be treated on your own, but with the assistance of a doctor that has success in treating this condition. I want to thank you for watching this video. If you like it, be sure and share, like, subscribe, and tell me how you're treating your health challenge if you have SIBO. And I hope to speak to you again soon. Thanks a lot. Bye-bye.